Hello, hello.
Yeah, India, please go ahead. Others, please mute yourself.
Yes, ma'am. A very good evening to one and all present here. We warmly welcome you to the Deccan Positive Mental Health webinar series. It is our privilege to extend a heartfelt welcome to today's esteemed resource person, Mr. Eric. Our enthusiastic participants and our dedicated guests on behalf of Manasa Supkara, Hyderabad, Yellowpond Wellness Center, India Forest Creative Studio, Punjab Refined, we thank you for being part of this initiative and focused on fostering mental well-being and positive change. Without further delay, I would like to introduce today's resource person, Mr. Eric. Mr. Eric is the founder of Badali Wellness Hub, a Kenyan firm whose objective is to inspire positive change by promoting mental wellness. A mental health therapist, trainer, and psychologist with over 5 years of experience as a clinical supervisor and hospital psychologist. It's our honor to have you here, sir. You may proceed with the session. Thank you.
All right, thank you so much for that introduction. Just to confirm, you can see my screen, right? Okay. All right. Yeah, that's my name. My name is Eric Chalo. I'm a counseling psychologist working with within an hospital, and of course, once a clinical supervisor. Looking forward to taking us through mental health first aid. Of course, today is 1st of August, and I believe that in the space that you are doing well. Maybe you can identify the emotion that you're feeling right now and maybe share with us in the chat box. That would be so good for us, for you just to share how you're feeling. But even as you do that, allow me to do just an introduction of what you're doing today. Once again, thank you so much for this platform. I'm looking forward to us having more of these platforms and learning from each other. In case you won't be able to hear me, let me know. And in case you want to ask a question or you want to do give a comment, you can kindly maybe just raise your hand, and then I'll be able to see you, or the facilitator will be able to see you. Maybe request you to hear your question or share your comment. Yeah, so today we're talking about mental health first aid. I don't know when you hear the word mental health first aid, what comes to your mind. I don't know if we can be able to share how, when you hear the word mental health first aid, what comes to your mind, if I'm allowed to ask. You can share in the chat box or you can raise your hand, then I'll give you an opportunity to share. Please.
Positive thoughts.
Positive thoughts. Awesome. Thank you for sharing that. Positive thoughts. When you hear the word mental health first aid, what comes to your mind? Optimistic. Awesome. Thank you for sharing that. When you hear the word positive mental health, what comes to your mind?
Away from toxic people. Avoiding anything that is toxic in the environment.
Okay, awesome. Thank you for sharing again. Awesome. Can share more? Can also write in the chat box and then I'll be able to see your comment.
Sir, you're on mute, sir, so we're not able to hear you. Could you please unmute your mic?
All right, thank you for bringing that to my attention. Sorry about that. So I was saying, okay, now I think I'm okay now. So at the end of this session, you should be able to define what mental health is and mental health first aid. You should also be able to to know how to administer mental health first aid. I know, I hope that I'm also talking to persons who have been attending the trainings through this particular platform. And I know you've talked much regards to mental health, and you are a mental health lay provider in the space that you are. So you should be able to know how to administer mental health first aid. A mental health lay providers doesn't mean that you can be able to offer therapy. It just means that you can be able to support a person who is going through a mental health crisis. That's why our objective today, one of the objectives again, is also to help you know how to administer the mental health first aid. Should also be able to know the difference between mental health first aid and psychological first aid, because there is a difference. Please, there's a difference. I don't know if you've done maybe something on psychological first aid, but if not, maybe today you'll just have a glimpse of the same. Should also be able to know how to give suicide first aid again. I do believe, I hope that you'll be able to have more time to maybe take us through the suicide first aid. If not, maybe we can do this next time. So this is what your part of the outline, just an introduction. Look at mental health roles and responsibilities. Mental health first aiders roles and responsibilities. Not because I'm taking you through this training. I usually do a mental health training which takes for about 1 week. So this is just a part of what we do. And when you go to that training, you become a mental health first aider, and today you'll be able to know some of the roles and responsibilities of a mental health first aider. We're also going to look at mental health first aid action plan according to World Health Organization, and it's called ALGI. Given the acronym ALGI, or ALGI, depending on where you come from and who your English teacher was in this case. Also going to look at the psychological first aid action plan. So said first aid you will be having. All right. I know we have an idea of what mental health is, but allow me to just bring to your awareness that mental health includes our emotional, psychological, and social well-being. Emotional meaning that you should be able to identify the emotion that you're feeling at a particular time. You should be also in a better space in regards to the thoughts that you have and how you interact with people in different social circles. So basically, what you're saying it affects how we think, how we feel, and how we act, or the behaviors that we have. We have the behaviors and the actions and the habits that we usually have, which also includes our personality, which goes down again to our personality and relate to others. We talked about how we act when we're within social relationships, and of course in making healthy choices. So whether you have a positive mental health or a negative mental health, it has an effect on how you are going to make your life decisions, how you're going to live with other people, and how you handle daily stressors of life, because we all have stressors in one space, in one time. And we actually usually say that mental health is a state, meaning that it can change anytime. Maybe today you're okay, and maybe tomorrow, because of the cold weather, and as much as you talk about maintaining positive mental health, it's also good to know that it can change with time. That's why we need to have resources within ourselves to be able to handle different to handle stresses different times. All right. So mental health first aid is often offered to a person who has a mental health problem or experiencing a mental health crisis, given until appropriate treatment. So it is given until there is appropriate treatment and support until the crisis is resolved. This actually means that you become a lay provider. As I did say, I do train on mental health first aid. It's usually a 1 week training. And at that time, you're given a certificate to become a mental health first aider, meaning that when you see a person or encounter a person who's going through a mental health crisis, you're able to support them until actually they see a psychologist, or they see a mental health practitioner, or they see a psychiatrist, right? Or they see a counselor. So that is what you're saying. Mental health first aid it's given at the time when maybe we don't have a psychologist yet, or when we don't have a psychiatrist yet, but you're the person who is in contact with the person who is going through the mental health crisis. Of course, it's good. It's also important to know that this is not a substitute for medical care, counseling, or peer support, as I've been saying. So this is just first, just like you can talk about when a person faints, what can you be able to do? If they start nose bleeding, what can you be able? How can you be able to support them? Maybe this person has broken their hand, how can you be able to support them as well? So that is what you are saying. You are the first responder. So how are you going to handle that particular person? So if you become a mental health first aider, or because you're talking about mental health first aid, what are some of the roles and responsibilities? And actually another question would be, why mental health first aid? Why mental health first aid? And sometimes mental health problems are common and professional help is not always available or even accessible. I don't know in your space. I hope you can hear me and you're still following. I hope I'm not too fast. Can give me a thumbs up if we are together.
No, sir, it's clear. Please continue, sir.
Okay, thank you so much.
Sir, you got muted. Please unmute. We can't hear you.
Okay, sorry about that. Yeah. All right. Sorry. The reason I'm doing that is just to ensure that we are going together. We are not leaving anyone behind. So mental health problems are common and professional help is not always available or even easily accessible. And as I was saying, I'm not sure which space you're in, but here in Kenya, to access mental health is actually very expensive. I think for you to get a professional mental health support, you need to have at least around 2,500 shillings to 6,000 Kenya shillings. Maybe you can convert that to the Indian currency and get to know how much that is. I don't know how it is maybe in your country, but here it is very expensive, so it is not easily accessible. And most people also have little to no knowledge about mental health problems, and that's not how know how to respond. If a person is experiencing maybe a mental health crisis, or maybe in this case an anxiety, they're becoming anxious, they're sweating. There's an exam supposed to happen in a few minutes, and you're the teacher. So how are you supposed to help this particular student calm down when they're experiencing this particular event? So most people have no knowledge about mental health, and that's why we are doing this. So you can be when you have been doing this, so that you can be able to create awareness about mental health, and even so that you can also be able to know how to respond. So today, actually, we're talking about how do you respond in that kind of crisis. And persons with mental health problems do not usually ask for help, unfortunately, either because they don't know that they need the help, or they don't know where to go to, whom to talk to, or where to go to. So that is why the mental health first aid is important. The statistics show that 1 in every 8 individuals, about 970 million, was said to be living with a mental health disorder. That is research as of 2019. And anxiety and depression are the commonest mental health disorders. I don't know if this resonates with your content or country, but depression are the common mental health disorders. This course goes for 1 week. I think September is usually Suicide Awareness Month,
Sir,
according to
your
what
internet is not
they have
proper, sir.
organization. So, but
Your
so behavior. This basically
your
means
voice
this person. Sorry.
your internet unstable, sir. Voice is not continuous. Your internet is not stable, sir.
You have a how about now?
Yes, yes. Okay, sir.
Can you hear me?
Yes,
Hello.
sir. Please continue.
Yes. Continue. There is a problem with internet. Continue.
Please continue, sir.
Hello. What happened? Why sound is not there?
You are not audible, sir.
Sure.
Maybe reconnecting, I guess. Not in the meeting. Maybe joining again. Eric, sir, you're muted. We can't hear you.
Okay. Sound.
Okay. Sorry. I'm back.
Yes. Now we can hear. Please continue.
Okay. Yeah. So I continue. All right. So I'm going to continue. Sorry about my network. Yeah. So we're asking ourselves, when do you apply when do you apply mental health first aid? And I think I was talking about when a person has suicidal ideations. Someone is unmuted. Can you
All
hear me?
others, please be muted.
Yeah, it's coming.
All right. So we're asking ourselves, when do you apply mental health first aid? And one, when a person is exhibiting suicidal behavior. And suicide behavior, we talk about when a person has a plan and has an idea and has a method of ending their lives. So that is when we can apply mental health first aid. When a person has non-suicidal self-injury as well, I know we know there are some persons who self-harm in different ways. This can be through use of substances, and sometimes they use maybe some instruments like maybe razor blades to cut themselves, or they just want to hurt themselves. So there are some non-suicidal spaces where a person actually does not want to end their life, but they just want to feel the pain and punish themselves. So that is another context in which you can be able to apply mental health first aid. When a person is also experiencing panic attacks, or they have gone through a traumatic event, and maybe when they're experiencing acute psychosis, maybe they have acute, or they have been able to experiencing the mental health status is not okay. Probably they are confused, or they are not oriented. And again, you can also say sometimes I also experience brief psychosis, or they have hallucinations. So you can be able to also support them by first of all by understanding and also giving them You're going to see how actually later on. But that is such an event in which in traumatic events, for example, a person has gone through an accident. A person I work with in an hospital setting, and most people who come to some people come to the hospital, sometimes there has been a motorcycle accident or a car accident, someone has been hit, and maybe that event has never happened again in their lives. And the question that they usually come with is, why did this have to happen to me at this particular time? And that is one of the spaces which can be able to apply mental health first aid. When a person is very in aggressive behavior,
will it be applicable for psychic therapy?
sorry?
Will this be applicable for psychic therapy?
Sir, questions can be at the end of the session, last 10 minutes.
Okay.
You please continue, sir. Erics.
Continue.
Yes, thank you. Yes, when a person is having aggressive behavior, in this space, you can be able to say, I don't know if you've seen persons who are very angry. They usually break things, or they beat up people, or they shout at their spouses, or the people, or they beat the persons around them. Someone has unmuted. Please mute. That is part of what you're saying. When a person exhibits aggressive behavior, we can be able to apply mental health first aid. Can you help me mute the person who has muted? As unmuted, thank you. Aggressive behavior, and again, substance use, excessive use of substances such as alcohol, or maybe marijuana. I feel like that is also a space in which can be able to apply mental health first aid. Remember that when a person uses substances for a long time, they go into a active addiction, and in addiction, usually addiction is a disease. Thank you. Yeah, addiction is a disease. And in that kind of a space, your role as a mental health lay provider, or if you've gone through mental health first aid, or you have the concept of mental health first aid, you can be able to support that person to actually know that they have a problem. So that is also another space you can be able to support a person. So one, suicidal behavior, and suicidal self-injury. This means that a person has no intention of dying, but actually they are harming themselves so that they can be able to punish themselves. Maybe because they went through an event, or they did something that is shameful, or they're suffering the guilt. So they would want to punish themselves. Panic attacks, traumatic events, acute psychosis, aggressive behavior, or substance use. And so what triggers that affect triggers? What are some of the triggers that actually affect mental health? One, when a person has lost a loved one, not just a loved one, but also something that is very important to them. In our country, we had young people from Kenya who were demonstrating because the government was very, very corrupt. And there are people who lost property. They lost property worth millions of shillings. And most of them, I would see most of them crying. I would see most of them coming out and saying how they're disappointed, how they're feeling, how they have lost a secondary, property, and how they had used a lot of time and resources to put on their businesses. So it's not just loss of loved one, but also loss of things or resources that are important in a person's life. Sometimes breakdown of a relationship or marriage or divorce again, that actually can trigger a person's mental health. Having children as well. I don't know if you had a session about postpartum depression, and I think especially new mothers or mothers are usually, or women are usually affected more when their mental health can be triggered by when they're having a child, or something happen, complications with having a child, or even in the process of the pregnancy. Sometimes you can also have your mental health can really be triggered. Sometimes when you have a chronic illness or a physical illness, such as COPD, you have maybe dementia, you are going through, maybe you have diabetes. Some of those chronic illnesses can predispose someone to negative mental health. You're starting a new job and you're all anxious on how this is going to be like. There are expectations that are being set for you. So how are you able to handle that? How will you be able to satisfy the new boss, be able to perform? The anxiety that comes with that can also trigger your mental health. Of course, increased workload. I've seen persons who come to the hospital and the doctors maybe do vital checkup for them, but again, they say that they can't see any form of illness. And that person is sent to see a psychologist because actually you realize that most of these persons is because they are overworking their bodies and their bodies are crashing, right? So increased workload can also lead to mental health breakdown as well, which actually affects the body. I mean, we have more time to talk about the body-mind interaction in regards to mental health. Poor relationship with colleagues or bosses and loss of a job, they can also be some of the situations that can trigger mental health. Can be able to trigger mental health. So when you have poor relationships with your colleagues, even with family members or with your friends, it can also trigger your mental health as well. Because again, you have invested in emotions, you have invested resources, you have invested, you've become vulnerable in these situations, and then you face betrayal or you face betrayal or something happens and and that can affect your emotional well-being. So peer relationship with colleagues, bosses, friends can actually affect your mental health. Of course, loss of a job, even lack of a job. If you don't have a job opportunity or you don't have a way to get maybe resources, then that can also affect your mental health. So what are some of the signs that you need to see so that you can be able to maybe know that this person is in a mental health crisis? If you experience frequent headaches and minor illnesses, remember, in the context that I work in, there's someone who was came to the hospital and they are diagnosed with an illness like chronic complex headaches. What does complex headaches mean? You're experiencing headaches for consistent period of time, and after being admitted, after scanning, after everything, they realize actually there's nothing wrong with your hair, with your brain. There's nothing wrong with your body, but the stressors have maybe are predisposed to this particular illness. So yes, so frequent headaches or minor illnesses as well. You're getting flus, you're getting small immunity actually is low because of stress, right? Yeah, they usually say that people who get ulcers, stomach ulcers, most of the time it's because of stress. We know what happens with stress. When the stress hormone is produced called cortisol, or produced in the body, how it actually can affect your body, even lead to diabetes in the long run. Insomnia, if you're experiencing lack of sleep or sleep paralysis most of the time, that is also maybe something to maybe check. If you are very unkept or a person present themselves as very unkept, you met a friend who has not been for 2-3 days, actually that is a sign of someone who is into depression. People who are in depression, they don't look after themselves, so if a person is very unkept, then that some questions can be put up. Are you okay? Have you? Why is this? Although we don't ask the right questions, but we would want to know how you can best support them. Let's say the loss of weight or gaining of weight. Sometimes people can be too much preoccupied with the issues of life and stresses of life. They forget to take care of their bodies, and the weight can go down. And sometimes a person can cope negatively by overeating, which can lead to certain weight gain. Increased errors at work, increased sicknesses or absence, increased sickness, absence, and taking on too much work. This can also be things you need to note. A person becomes too irritable or very aggressive. I think that is also actually a concern. And that is why I like to one person actually approach me when you're doing a medical camp at some space. Someone approached me and told me, by the way, Eric, I feel like I'm too angry. I beat my child so much until I feel guilt. But I cannot, it's not something I'm able to control. I just find myself. And I just beat up my kid, and then later on I'm like, by the way, did I have to do it? Even if she just made a small mistake, did I have to? She realized that she has too much anger and bitterness and aggression and very irritable. And then she was like, hey, I think I need to talk to you. So irritability can also be a sign that can show, hey, this person maybe is not okay. Increased consumption of caffeine or recreational substances like maybe alcohol. Someone is misusing maybe marijuana, or someone is using the local alcoholics, alcohol drinks. I feel like that is also something to take note of. A person is drinking the whole weekend from Friday till Sunday. Then on Monday they're supposed to be at work. We call it binge drinking. which is not actually an unhealthy way of coping. Forgetfulness, indecision, and loss of confidence. You find yourself forgetting much, or you're not able to make decisions. You get confused. You are not sure of the way forward. You're stuck in life. You don't know what to do. Then maybe you need to talk to someone, or you need to actually, if this person present themselves and they say, I think I'm struggling through this, then you can be the person who can be able to support them. Sometimes loss of confidence and low self-esteem. Me having been in high school, I know how it feels like to struggle with low self-esteem, and I can actually identify a person who is struggling struggling with confidence and low self-esteem, and how that can affect them setting up boundaries. How them expressing themselves, expressing their needs, and actually not being used. Right? So some people who, because of they don't have confidence, they can be used by other people in a negative way. They can be manipulated, or they can succumb easily to negative peer influence. So these are some of the signs that you can note that, I think this person might need help. Or if you realize that you have these signs, that means that actually you might need help. Always remember that even as you have a mental health first aid, you're not a hero. You're just someone who is trying to help. I want you to imagine. I don't know how many minutes I have. Okay, I have some minutes. Yeah, so I want you to imagine you are at a restaurant and you see someone experiencing what appears to be a panic attack. What will you do? You're in a restaurant, you're having some coffee or you're having some tea, and then you see someone starting to experience a panic attack. What will you do?
Grounding techniques.
Grounding techniques. Awesome. Thank you for sharing that. What will you do? Yeah. What will you do? I want to hear from us. Someone has just mentioned the grounding techniques, which actually works very well. Or a very important question to ask. So what if now you're not able to help this person? That is why we are saying mental health first aid is really, really important. So what can you do? Right. So I believe that by end of this training, or by end of this class, you'll be able to know what you can be able to know. Mental health action plan, as I did say, it's called ALGI or AGI, depending with where you come from or who was your English teacher. But this is just an acronym. And this is what it means. A means assess for the risk of suicide and harm. Always remember, when you're supporting someone, the most important aspect is ensure that that person's safety is prioritized. So assess for risk of suicide. This means that you need to ask the question of, has this person be having ideas of death or dying? Have they thought about dying? Have they had a plan? How they're going to do it? Where they're going to do it? Do they have a method? Do they have a way? Do they have access? Are they going to use a gun? Are they going to use some pesticide? Are they going to use maybe throw themselves in front of a car? So in mental health first aid, always assess for the risk of suicide as well. Of course, you need to learn to listen judgmentally. We're going to see how to do that. We're going to give assurance and information. Sometimes people just lack information and reassurance, right? So G stands for giving reassurance and information. E stands for professional help. Remember, in this case, you're not a professional. Or in case you're a professional, well, how far mental health first aid. There are some instances in which, as a professional, you can do a session. You cannot sit down someone in an open space and just do a session like, I'm gonna do therapy. That can just happen. I know we know the ethics that guide mental health spaces or mental health support. So in some instances, you just need to give mental health first aid, even if you are a mental health therapist. So encourage appropriate professional support. And actually, part of mental health first aid must actually mean that you need to call a doctor to come and attend to the wound, or to come and attend to what is happening to them, maybe looking at their body. So their safety comes first. Just to give an example, a person cannot be in an accident and they're bleeding, and then you've already started to give mental health first aid. right? You're asking them, by the way, how are you? How many are you in your family? You know, going to ask them the question, tell me about your childhood, right? So you need to ask yourself, what is the professional help that I can get you? Encourage self-help and other support strategies as well. Especially if the person is confused, can't be able to make a decision. So how can you be able to support them? Do you need to maybe recommend a book? Do you need to maybe tell them that maybe you can be having frequent meetings and discuss about issues of life and maybe what they are really stuck in, right? Or even give them a contact that can call, maybe a therapist, be able to support them. So one, how do you listen? Because we talked about listening judgmentally. Listening is very different from hearing. I don't know if you know what hearing is. Hearing actually means I don't know if there's something happening in your environment. You've just heard. But listening is hearing, you just hear something, then it's not in your, it doesn't sink, it's not in your consciousness. You just hear, but then it goes away. But listening means that you give your full attention. You look at that person to the face, not like staring, but actually maintaining eye contact. So that is giving your full attention. You do not interrupt them as they talk. You do not judge or criticize. And don't place yourself, and you need to place yourself in their shoes. We call that empathy. So don't judge, don't criticize. I don't like the why question. The why question, as I was saying, is usually very judgmental. Why are you crying? Why are you feeling that? Why did you come? Right? Why did you that is more of judgmental or criticizing question. I don't like it personally as a practicing mental health therapist. So those are the things that you should be able to do. Give full attention. Do not interrupt them as they have a conversation. Place yourself in their shoes as well. So if you're the one who had gone through that crisis, what would you do? Actually, you can ask them. You can even you can be able to put yourself in their shoes and be able to emphasize with them. What are some of the questions that we need to ask? How are you feeling right now? This person is experiencing a panic attack. So how are you feeling right now? For how long have you been like this? How long have you not been sleeping? How long have you not been eating? How long have you been having the suicide ideas? Do they just come and go? Right? So how do you feel? Who do you feel you can reach out to for help? Who do you think can be able to support you? I think when you're doing suicide management, we usually tell a person, if you're supporting a person who is planning to die and they're telling me I want to die, the best question to ask them can be, before you do that, whom do you want to tell? Right? Who is that person that you can tell, actually, by the way, I want to die, I want to end my life? And then you can use that person. When they answer that question, you can use that person actually to talk them out, because there's something about that person, and this person who wants to die, and the reason why they won't talk to that person. So it's a very good question to ask. So how do you feel? Who do you feel you can reach out for help? Is there anything I can do to help you? Right? Okay, yeah. So these are some of the questions that you can be able to ask in this context. Yeah, I think there was a question. Oh, someone was unmuted. Thank you. So yeah, is there anything I can be able to do to help?
Hello.
Please mute.
Hello.
Please mute. You the one was. Yeah.
I wanted to know
Yes,
whether
is
this
there
can be
anything?
used with
Okay. Panic attacks. How many minutes do I have? I have some 10 minutes. So panic attack signs. So I think I give a context of, if you see a person who is experiencing a mental health, maybe a panic attack, how can we be able to support them? So what are some of the signs that can actually show that this person has a mental, is in this kind of crisis? So they have sense of impending doom. Something is just about to happen. They feel as if the world is falling apart. They fear death, and they feel like they're not in control. And sometimes they experience chills. They might be shaking, or they start sweating. their hands, they're fidgeting, they look restless, sometimes shortness of breath. Someone talked about the grounding techniques, right? Shortness of breath, rapid pounding of the heart rate, setting a panic attack. And how can you be able to support them? You want not panic, you can just affirm them, reassure them, stay calm, stay calm, stay calm. Let them know you're willing to help them and support them. Ask if they know what is happening to their bodies. Do you know what is happening? Do you know what are you feeling? So let them know that you're willing to help. Ask if they know what is happening. If you're not sure it's a panic attack, seek medical assistance. Sometimes you can assume this person is having a panic attack. Maybe they're having a heart attack. So if you're not sure of what it is, then seek medical assistance. That's why we say it's very good for us to understand these mental health conditions. That's why I was saying the mental health first aid training takes one for us to be able to maximize, because we let you understand what panic attack actually looks like, what anxiety actually looks like, what brief psychosis actually looks like, what delirium actually means. So that now when you're in that space, you don't misinterpret. Remember, you are a mental health provider, lay provider. You're not like a specialist, right? If they believe it's a panic attack, reassure them that you're there. Maybe you can let them hold their hand. The person is going through maybe anxiety attack. You can be able to hold their hand, or you can be able to give them something to hold. Someone is unmuted again. You can be able to give them something to hold in their hand. So don't tell them to get over it and say there's nothing to be scared of. There's some things you should be able to say. Please unmute. Please mute. Please unmute.
Hello.
Sir,
Unmute.
sir,
Hello.
questions after 5 minutes, sir, after the class ends. Let's please.
How the confidence loss? I want to ask how the confidence loss can be regained once again in a confirmed way.
Okay, yeah, that's a very good question. But allow us to finish, then you can ask the questions later. Maybe you can just mute, we finish, then you can ask them. Just read the question somewhere. So we're talking about how you can support a person who has a panic attack. Don't tell them to get over it, but there's nothing. And that's anything that would be the make them feel better. Sometimes kindly mute. Kindly mute. Thank you. Thank you so much. All right. So I was saying, don't tell them to get over it, or don't say that there's nothing to be scared of. Don't say that. Ask them actually if there's anything that will make them feel better. Because sometimes you think that we have the answers people look for, even as therapists and mental health providers. We feel like we usually have all the answers, or we have what people need. But basically, sometimes people know what they want. So maybe if you ask them then that will make them feel better, you're prioritizing unless they tell you, I don't know, maybe now you can give some suggestions, or ask them what they have tried before and has worked. So if there's anything that would make them feel better, then I feel like that's a very good question to ask in this context. So I hope that right now, in a context of a person experiencing a panic attack, you have the right tools, or you can be able to use to support them. Another exercise: you are at a restaurant and you see someone experiencing what appears to be a panic attack. What will you do? I think we went through that. Now I think you can be able to answer this based on what we've just discussed. So what is first? So as I said, we have psychological first aid and we have mental health first aid. So what is mental health first aid, and what is psychological first aid, and what is the difference, right? But before we get to that, PFA is the evidence-based modular approach to help persons in the aftermath of traumatic events, right? So this is just not something that you're learning today, but it is something that has been recommended by World Health Organization. It's something that is very practical and about this particular concept, and that it is very much applicable. It is designed. So it is designed to reduce the initial stress from trauma and foster functioning and coping. If these persons have gone through a traumatic event or a stressor, so it is designed to reduce the initial stress at that particular time, right? So, and developed by National Child Traumatic Stress Network and the National Center for PTSD. Sorry. So what is the difference between PFA and MHPFA? So psychological first aid assists people in the immediate aftermath of a disaster. So for example, in India, we had the plane that crashed when it was just leaving the airport. I know we saw that. And we are really sorry for those persons who lost their relatives in that space. So when that event happened, were there persons who came to offer psychological first aid? So you assist people in the aftermath of a disaster. When there has been a tsunami, when there have been long rains and there are floods. So we need persons to come and offer psychological first aid. Mental health first aid helps people with mental health problems specifically on a broader focus in this case. Again, psychological first aid is not focused on any mental health diagnosis. It's just a general way of supporting a person who has gone through a crisis. Mental health first aid on this other side helps people identify symptoms of mental health problems. We talked about insomnia. We talked about all those other stressors and symptoms of mental health problems. So you help people identify. And that's why I've been saying that for the training, this would be a training. We talk about the different mental health conditions and the symptoms of the same, so that when you're offering the mental health first aid, you're able to know, this is actually might be a sign of a panic attack. This is maybe some brief psychosis, or actually this is delirium, but actually this is just a coping mechanism. And psychological first aid aims to prevent negative changes, including development of mental health issues. And mental health first aid aims to help people with mental health problems specifically. So psychological first aid helps to prevent negative changes. Maybe there has been some fire, and maybe there was a child involved. A child has been rescued, right? So this child might have repetitive flashbacks about that particular event. But when you offer psychological first aid, then you're able to know maybe how you can be able to support maybe this particular child in that context, so that now later they're not going to be exposed to PTSD, right? That is what we mean. And psychological first aid is to help people with mental health problems or mental health symptoms, like binge drinking. All right. So we have a question. Imagine yourself at the scene of recent bombing in Gaza. Oh, someone has
Please be muted.
Someone has unmuted. Please mute. Please mute. So you have another access. Imagine yourself at the scene of a recent bombing in Gaza. So what would you need as a survivor, and what you need as a helper? Imagine yourself at the scene of a recent bombing in Gaza. So what would you need as a survivor, and what would you need as a helper?
Survivor.
So one, you need to
mental
prepare. Yes.
Mental strength as a survivor. Emotional strength.
Oh, awesome. Emotional strength, very true. That is as a survivor, right? As a survivor, you need emotional support. That's a good one. What
Helper
else would you
needs
need?
empathy. Helper needs empathy and giving comfort and security.
Definitely, I agree with you. I agree with you. Thank you for sharing. I agree with you. There's a lot of emotional support needed because maybe this person has lost someone close to them. So as a survivor, you will need the emotional support. And then as a helper, you might need enough resources within you to help them. You might need empathy. And I think sometimes as helpers, you can get so burnt out so that you don't have compassion. You get compassion fatigue. Compassion fatigue is where you've been able to help so many people such that you can't be able to offer empathy anymore. You can get that space. So as a helper, you might need enough resources within yourself to be able to support them. That is why you need to go through the training to empower you mentally with a lot of self-awareness and resources within yourself, so now you can be able to support someone else. So one, you will need to So you need to so there is that. So you want to prepare. So you need to understand the event, the crisis. One, what happened, when did it happen, and when did it happen? Who and how many people were there, and how many people were affected? I give an example of a plane that maybe crashed when it was just leaving the airport. Sorry about that. Yeah, so just leaving the airport. So maybe you need to understand what happened. You need to understand where and when. So that maybe you are, I want to you're just to imagine, you're just a mental health provider, and then a crisis has happened and you received a call from the community leader. You just come, there's something happening. So you need to ask these questions. You need to prepare. What has happened? Where has it happened? When did it happen? And how many people are there? And how many people have been affected? So that if you need to call ambulances, you need to know how many ambulances you need to call. You need to ask yourself, what are the available services? Do they have people who can give blankets? Do we have service providers that people can give food? Who is helping? Are there organizations? Are there community members who can help? I think after the crisis in India, I saw very many community members come out to help, to see if there's someone who can survive, to support people who are grieving at that particular loss. So it's the community members as well can very much help. Safety and security. Is the crisis over? Don't go to a space where people are still fighting to offer mental health support or psychological first aid. You can also get shot, right? So ask yourself: is there security? Is there safety? And is the crisis over? So what dangers are there? Are there places that you need to avoid? Are there places that you need to go and places you can't be able to actually go and help people? Right? So you need to observe for safety. Of course, you need to identify people with urgent basic needs. Maybe there's someone who does not need an ambulance. There's a person who needs an ambulance. So as a mental health first aid, you should be able to just it clicks to your mind that, hey, I think you might need more help than this. This person needs more help, an ambulance, but you don't, right? So identify people who have urgent basic needs and which person you can be able to help. You need to identify that one person can help and that one person that you can't be able to help. Maybe the person who needs more medical assistance rather than psychological assistance at that particular time. You're in the crisis moment. So you need to identify who actually needs help or your help specifically. So if there are people who are in distress or they are reacting because of what has happened, how many people are they? So that even as you go there, you need to call a colleague. Can you just come and help? Is a crisis happening? And we have 10 people who have been affected, and we might need more psychologists. We might need more community health members to help. So where are they? How are they reacting? And I usually say, even for you to support a person who's having mental health condition, your safety also matters. Maybe this person is going through a brief psychosis and they're very violent. Don't just go and ask them to. You need to take care of yourself. So assess if actually this person is in a space you can be able to approach them, so that you won't be beaten up. I remember an instance when I was working in the hospital where one of the family lost the closest member of the family. And she was very sick, but she died, unfortunately. Right? She died, unfortunately. So what you're saying is, in that particular context, you don't just close yourself in the same room with the family. They might beat you up because of what is actually happening to them, or the emotions that are in the air, right? So they might beat you up. So in a crisis like that, where there is a lot of people mourning because of that particular event, don't close yourself in the same room with them and you're the only doctor. They will beat you up. Why when he was dying, where were you? Right? So you need to, are they extremely upset? Are they in shock? Can you let me know when the time is done so that I don't take a lot of time? But you need to observe. Look, you need to listen. I think we talked about listening, making contact, approach with respect, introduce yourself, ask actually if you can help, and help them feel comfortable. Ask about the needs and their concerns. Don't assume that they need to talk to someone. Find out their priorities. Maybe you think they need a place to sleep, but maybe they just need a place to maybe have their family member taken care of first. So find out what their priorities are. Don't assume that you know what they need, right? So help them feel calm. Watch how they engage with you. Stay close, but close enough, right? No pressure. Actually, listen, listening. I think most of the time when we're doing debriefing, we most a person might want to talk to encourage, but maybe you just need to keep quiet and ask the right questions the right way. And then by the end of that session, you're going to find actually you have a lot of people. Link, address basic needs, help them access services. So what are they asking for and what is available? If they're asking for 3 blankets, but there are only 2 blankets, how can you communicate that to them and actually help them get them what they need? If they don't have enough, link them, right? Give information, find accurate information, keep the messages very simple and remain calm. I think that is one of the things that our medical sectors lack. Maybe a person has been diagnosed with chronic illness, maybe diabetes or HIV/AIDS, but this person, the medical clinical officer does not have maybe the empathy to communicate that. So what they don't know how to give the message simple in a way the patient can be able to understand. They're going to use big words like ambulating. Ambulating means walking. Just keep the messages very simple and remain calm. Connect people with loved ones and social support. Maybe a crisis has happened. Those people need to be connected with their loved ones. That can actually help. Remember, sometimes that's why I was saying, don't assume that you know how to help. Don't assume. Maybe this person needs to talk to their mother. And actually, in the places of grieving, a crisis of people who are grieving, personally, I don't approach them. I just ask them, can I call your husband? The husband comes and they embrace them and they feel safe. So as a therapist, I can go there, talk, and I'm not helping that person. They just needs a family member. So do you need to call the family member to come and support? I hope that makes a lot of sense. So link. All right, now imagine yourself at the scene of a recent bombing in Gaza. What will you need as a survivor and what you need as a helper? Very, very good question. Not because you've gone through how you can be able to support them. I hope now you're in a better position to help past people who have gone through a crisis. All right.
Sir,
So I think
question and answer session, sir.
Sorry?
Can we go with question and answer session, sir?
Yes, we can. I think I'm done. Thank you so much for that. Maybe next time we can do suicide first aid. Yeah. So thank you so much, everyone. And
Question.
now because yes, please.
Yes, sir. Yes, sir. You are saying something.
Oh, sorry. I just wanted to conclude and say that there are millions of people who are facing the same things, who may feel shame and fear and live in isolation and silence. So sometimes let's find the courage to start the conversation about mental health. And if you don't live with a mental health disorder, but know someone who is living with it, you can try to put yourself in their shoes. And it is usually said that our capacity for empathy is also what makes us human. So please, we can always be the person who is able to support others. Thank you so much for being here and listening to me all the way from Kenya, and looking forward to more interactions. Maybe we can take questions.
Thank you so much, sir. Anyone want to ask a question can unmute and ask now.
I have one question. Mr. Eric. Hello.
Yes, please.
Am I audible?
Yes, you are.
Mr. Eric. The question is, always have fear about this cloudy weather and rain. We have given many options, but he is not. Well, the moment start panicking.
Prakash, sir, your voice is very unstable. We could not hear your question.
Maybe he can just write down if he's able to. All right, we are taking questions, please.
Prakash sir, if your internet is unstable, you can put the question in the chat box. Okay, anybody else want to ask any question? Yeah, Praveen sir, you can ask.
Thank you. Thank you. So my question is, there can be two or three kind of person who, someone who doesn't know anything about mental health, and there are another kind of person who might know some basics about the mental health, and there are some people who have uh, some amount of better amount of awareness on the mental health. So how to differentiate these people in the treatment process, even though they might think about something about mental health and all, but they are maybe rigid or they are not, coordinating better with the therapist or the counselor. How to
All right. I'm not sure if I got your question quite clearly, but I think I had to ask if there are two people. One person has information about mental health, and the other person does not have any information regarding mental health. To respond, what the question was. I don't know if it was how do you create awareness, or maybe you can just repeat the last part, or if Prakash able to hear, maybe you can help me understand.
Okay, let me say it again. So my question is, the people who are very much unknown about the things uh, may coordinate better with the therapist, but the people who have some kind of information regarding the mental health or a better kind of information, they might have a kind of rigidity while coordinating with the therapist. So how to deal with these two different kind of peoples?
Okay, right. Thank you for that. I think one information is very important. I think mental health information can be relayed in different ways, different platforms, and I think lack of understanding can make a person who thinks they know about mental health miss out actually on mental health. Yeah, I think you can mute you answer. Yes.
Yeah, Eric, it was a fantabulous session. We thoroughly enjoyed. We are looking more sessions from you in upcoming days. Yeah, with your permission, we will go for VOT. Yeah, Archana, please go ahead.
Yes, ma'am. Good evening, everyone. As we wrap up this enlightening session on mental health first aid, I want to express my deepest gratitude to all who contributed to making today's event a success. A special thanks to Eric sir, whose expertise and engaging approach turned this session into inspiring experience. Your insights on applying mental health first aid in real life situations will greatly empower us to make a difference. We also owe our gratitude to the organizing team and our partners, Yellow Pond, Forest Creative Arts Studio, Sridipti Counseling Center, Clover Learning Center, Srisha Counseling Center, and Mindstyle Hub. Your unwavering support ensures that mental health awareness reaches more and more people each day. Today, we have gained vital tools to address challenges like suicidal behavior, panic attacks, and substance abuse, and many more. tools that will help us respond with empathy, calmness, and understanding as a listener. Thank you again, Eric sir, and to everyone for your participation. Let's take this knowledge forward and continue to make a meaningful difference in the lives of others. Thank you all once again. Thank you, sir. Let's meet again, everyone. Thank you.
Thank you for the opportunity. Bye.